Hi everyone, I just wanted to review the different layers of skin so that you get an idea on what we're actually putting the suture needles through. The first layer that we're going to encounter is the epidermis, also known as the most superficial portion of the skin, the top layer. The second layer of skin is the dermis. The dermis can have anything from adipose tissue along with it, so you just have to make sure that if it does have a lot of fat cells, that you're actually grabbing more of the dermis itself as opposed to the adipose tissue. And then lastly, we have the subcutaneous tissue that is the deepest layer of skin. It is important to make sure that we actually grab all three portions of the skin layers and to ensure a secure suture knot and hold, as well as to eliminate dead space. So as you guys can see here, we would have the suture go through all three layers. When you have things that go through all three layers, it actually has a nice close to it. So it approximates all the different layers so that it does not create any dead space. When you're only doing your epidermis and dermis, there is that potential of having that dead space. So dead space is the space left within the incisional mark that is not closed. Why is this important to know or to close? Is if you have an area that is not closed, it actually leaves the area to be a victim to bacteria and infection, because this dead space that they're talking about here is going to allow bacteria to actually grow and thrive, therefore creating a post-operative infection. The incision itself and the surgery site is already prone to having that, but we want to make sure that the risk is lessened by closing all of its layers.